CPR. Am I certified at this point after taking your course?
Yes, and you are also covered by the Good Samaritan Act.
Really?
Yes.
Oh, thank you very much.
Yes.
So there is no fear there of somebody that jumps in to help out.
Correct.
Um, and the certification, how often does somebody have to be recertified?
Every 2 years.
Okay, that's anybody that takes it.
Yes.
What are some of the things that people get a little bit scared? Is mouth to mouth still part of the CPR process?
Well, no. Healthcare providers would use a barrier device, which is like a face mask. The most important thing, American Heart recognized that most people would see the guy outside of 7-Eleven, recognize an emergency, but they look at it and go, I don't want to kiss him. So American Heart has really focused on hands-only CPR. So CPR is not going to save your life. It's the AED, or the automated external defibrillator, that is really going to bring you back. So when blood sits, it tends to clot. So the most important thing is for somebody to get on the chest and start doing compressions hard and fast.
I never understood why you do the compressions. That was just a one sentence explanation of why you do it.
Yes. If you had just been breathing, you have oxygen still hanging on to your hemoglobin molecule. So what we're doing is circulating the blood around to try to provide oxygen to your vital organs.
We're talking to Kay Bressler. Her company is RN The Know. What else do you do at RN The Know?
I do mobile cognitive evaluations
All
for.
right, now you've lost me on that one.
Well, sometimes situations arise where people's judgment comes into question and it impacts their daily living and abilities to function. Physicians aren't inclined to make house calls, and generally the people who need the evaluation know enough to know they don't want to go to the doctor. So when asked if it's okay if a nurse comes to see you, most people know that they can trust a nurse, and they're very open to having us come into the home. So I can do that evaluation as a provider because I'm an advanced practice nurse, and I can bill Medicare for that service.
Does this include ability to drive?
No, it's more judgment
Okay.
and your
Okay.
ability to process information.
So you're basically giving them a report card on to the individual or the family as to whether this person is becoming a danger to themselves.
It's mostly their judgment, excuse me, and their ability to make sound decisions and understand the repercussions of those decisions.
My wife would probably want me to take that.
Well, I can hook you up. So it's a very long assessment, and it goes over a physical evaluation, and then I have cognitive tests that I do. Once I'm done, I have my own electronic health record. It's secure. I transmit that information to the person's primary care physician so they can look over it and make a determination.
All right. And again, this is billable through
Medicare.
It is?
Yes.
Is there an age breakdown on that?
Well, generally, most people don't have Medicare until they're 65.
I haven't. Well, I have one of them. I don't know what it is.
Yeah.
I can never remember. They'll always, whenever I go to the doctor or somewhere, they'll go, do you have Medicare? And I go, I don't know which one I have.
So essentially, when I'm consulted, Adult Protective Services are kind of in a bind because they can't get an evaluation on the person. They have to continue going out to the home to make sure the person's safe, and it's kind of a barrier and a burden on the system.
So does your evaluation then open the door for professionals to come in to be with the person?
Usually it's a determination whether they can stay in the home or not.
Okay.
And it's to help pave the way to get them in a better situation. Some people are in their homes. It's unbelievable, really, some of the situations that you walk into that are not safe, not good for the person. They're not bathing, they're not eating, they're not managing their bills, they don't have power on sometimes, and Only a judge can determine whether you have the ability to make decisions. Only a judge can strip you of your legal rights. As American, that's one of our most prized abilities is our freedom. It takes two physicians to determine whether you have capacity or you don't have capacity to make legal decisions. So the evaluation that I do, the physicians base their judgment on that.
That is a shoulder full of responsibility. I don't know if I would ever want to even be in that position to make that decision. But like you say, you use a comprehensive test. To
Yes,
determine that.
evidence-based metrics are used, and I look at it as it's helping this person live their best life.
Do you do this on your own?
No, I'm consulted. Do you mean?
No, I mean, do you have a workforce that works for you, or
No, it's just
you're
me.
out doing all this yourself?
Yeah, that's the beauty
When
of.
do you sleep?
Trust me, I get plenty of Z's. That's the beauty of my business is that I'm not pigeonholed into one thing, and I really like the variety of what I'm doing and the freedom. I like to drive around. I like to travel, go different places, see different people, but the variety is really what I've enjoyed in my new business.
And in many of your situations, when you are called in, you are then in a position to refer to other outlets.
Absolutely. Interprofessional practice is the gold standard today's practice.
What does that mean?
That means we're a team and everyone has a specific role. And my background as a critical care nurse and as a case manager, I am able to determine which resources meet that patient's needs or that person's needs the best.
I want to touch on the other aspect we talked about with respect to RN the Know, and that is with respect to an older person and their wishes.
Well, number one, having an advance directive is not for just the elderly or the ill. Anyone over the age of 18 needs an advance directive. I think when I talk to people about
Whoa. Really?
really, if you are unable to make your own decisions, that advance directive speaks for you when you are unable. And what happens is it relieves your family of making very difficult decisions at a difficult time.
So we're talking about a 25-year-old with advance directive.
Absolutely.
It says they don't want to be hooked up to tubes and fed through tubes and everything.
Absolutely.
If I get to that point.
Absolutely. If you leave it up to your family, 9 times out of 10, they are going to err on the side of life.
It's a very hard, very difficult.
Yeah,
Oh my
because
God.
they're
Yeah.
afraid, they don't want to deal with the guilt later on. And I think most people, when they first hear about my end-of-life education programs, it conjures up images, oh God, it's going to be a heavy conversation. But it's really not. I'm straightforward. I explain everything they have questions about, and we get the documentation in place. I'm a notary, so I can notarize the documents. But it's not a heavy conversation. It's actually kind of fun. It's a much lighter conversation when you come to me instead of waiting for the critical illness to happen, because we never expect it to be us. And then sometimes you wait too late, and it just makes everyone miserable.
Well, I could understand the family standpoint, because from a decision-making process, there's always the what if.
Right.
What if we had waited one more day?
And they second guess themselves. It's
Yeah.
true. But if you go ahead and create the document, they don't have any decisions to make. And they can, be in the moment. They can grieve. They can hold your hand. They don't have to worry about all these heavy topics,
Well, I go back to Mr. Budd. When they came in, he did not have an advance directive. They came into the room and we were talking about different things, and they said, if you stop breathing, do you want to be resuscitated? And he looked at me and he went, do I?
Yeah.
I'm his neighbor.
Well, and it's because they really don't understand what's involved. I have the range of tubes. I show everybody and tell them how long they can stay there, and then we move on to this. I bring in my case management experience and talk about coverages like healthcare coverage, what Medicare pays for, what it doesn't pay for. I distinguish the differences between palliative care, and hospice. Most people don't have a firm grasp on what that means and the
don't.
benefits.
Now, I just went through this with him, but I'm not sure what
Palliation just means symptom management.
Okay.
We are still
Okay.
going full force,
Yes.
treating the person, but say they have problems with pain, shortness of breath, constipation, whatever the
We're going to
issue.
keep you comfortable, but
Well, we help the symptoms. Sometimes we get 85-year-olds that are on a handful of pills, and sometimes you have to look at it and go, really, why are we still doing this pill? If it's giving bad, untoward symptoms. Where hospice acknowledges that you're going to die and we can't fix it. And so they can get that 6 months prior to when we're anticipating them to die. And it really helps the person adjust, come to terms with their life, and it helps the family so much understand what's coming. And it helps kind of a letting go, and it helps them live their best life, fullest, with dignity, as independent as they can be. It's a really good thing.
so keeping all that in mind, how does somebody find RN the Know?
Well, I have a website, www.rn, like registered nurse, KNOW.com.
All one word?
All one word. Or you could give me a call, 757-869-8529. I'm right on Thimble Shoals, 703 Suite D1.
And you do travel.
I do.
How
I
far
love to.
will travel?
Yes, I love to travel. I listen to the radio as loud as it will go, 99.1.
You might as well give me an unsolicited promo.
That's right.
now.
Yesterday's favorites and today's hits.
Well, what we want is, hi, this is Kay Bressler from RN
Butler,
the Know.
Kay Butler.
Why do I keep calling you?
I don't know.
That's how I wrote it down. Hi, this is Kay Butler from RN the Know, and I love the morning show.
Hi, this is Kay Butler from RN The Know, and I love the morning show.
I love unsolicited promos. Kay, listen, you've opened my eyes a little bit more as to what you do at RN The Know. Don't you have a satellite office?
No, I live here in Gloucester.
Oh,
I've been a
okay.
resident 25 years now.
Okay.
But my career has been primarily spent in Newport News at 2 out of the 3 major health systems.
Okay, and you work with everybody.
I'll work with anyone. Yes, I also do nursing tutoring for student nurses who can't pass the boards. I work with them to bone up their knowledge and their skills to get them to pass.
When do you sleep?
Well, it's just really cool to be able to. Somebody says, "What do you do?" and I kind of ask, "Well, what do you need?" Because I can do so much. I hate to pigeonhole myself into one particular thing when there's so much that I can bring to the table.
And I've asked you once before, what inspired starting RN the Know?
Neil, I was doing really well at my job, had been there over 10 years, and doing really good work, but it just felt like God tapped me on the shoulder and said, come on, you're mad about this, let's do something about it, because I just saw so many unfair situations with families and patients. And so I said, really, God, I don't know how to run a business, but he says, go, here, I've given you everything, just walk in faith. And that's what I'm doing.
Very good. And how long have you been in business now?
It's been just over a year. I opened my business doors April Fool's Day.
Okay.
Yeah, I don't know if that's a harbinger of things to come, but I also do public speaking, so
That's not a surprise.
I do a little bit of everything.
Yeah. So you will go in and a civic organization, a group, you'll go in and talk, we would like to have somebody come in and talk to us about the final, the directive or
Sure.
CPR, whatever
I
the
just
case
want
may
to
be.
bring awareness, knowledge. I kind of want to change the conversation. I want to steer people away from thinking this is just for the elderly, just for the sick. This is for everybody. And I'm kind of cool to talk to. People seem to get a kick out of it. Come see me.
A quick question. Somebody, if someone has a final directive, where do you keep it? How do you direct somebody?
The biggest thing about advance directives, most people think they keep it in the safe deposit box with all their lovely possessions, but really you need to keep that with you. And the people that you name as proxies are the people that will make decisions when you're unable. You give each of them a copy. And by golly, talk to them and let them know that you've named them. So many times we've run into situations where people were really caught off guard and said, oh my goodness, I had no idea they had named me. We never talked about it. So I'm just trying to open up the conversation.
I mean, do you put it in a laminated card? You keep it in your wallet or your purse?
No,
or?
it's a document, 8x10 or 8x11.5, I think. One of the healthcare systems locally, I don't know if I'm able to say them.
Sure.
Centera will register them on a national registry, but the other two hospitals do not participate in that. So, which is a shame. But
Is there a way to do it yourself?
no.
Oh, there isn't. Okay.
No.
So it has to be done. All right.
No, and I would advise someone every time you go into the hospital, bring it with you. And the reason,
Oh, they always ask.
well, the reason for that is because your life changes, your lens changes, and sometimes you change your mind on what you want. What you want as a 25-year-old might not be the same thing as an 80-year-old.
Sure. Okay, listen, thank you very much.
Well, thank you for having me.
You've been on twice, and both times I feel like I've left class and I'm ready to take the test.
Well, you can come on
If I
over
get
to
your
my
name
office.
right.
Well, that's okay. Just don't call me late to dinner.
Okay, thank you very much.